Thank you.
We'll call this board up in order on Monday, May 1st, 2023. Is there any changes to the agenda? Do I have a motion to approve the agenda? Second. All in favor? Do I have a motion to approve the minutes from the emergency meeting on March 20th, 2023?
So moved.
Have a second, all in favor? Comment.
Each of you have a copy of our, community health assessment in front of you. We received approval from the state in February, and we have to bring that to the board for our accreditation process. So I had to bring a copy for all of you to review and talk about our priorities. Our first priority is mental health and substance abuse in Grant County, and then the second priority is obesity and heart disease. How the health department plans on addressing these, we're working on grant funds, of course, to continue peer support. We are applying this week for one of those that I'll discuss in the grant section. And we are working to obtain a health fitness grant and wellness for our community. I have been working with Brian Husky with Great Smokies Foundation, and he thinks we have a very great shot at getting the Cannon Foundation grant for a fitness center.
That's great.
Found the location that I'll mention. I've been talking to a privately owned business owner. He's coming in 2 weeks. I talked to him yesterday. He was planning on coming in this week, but his wife had surgery. So it'll be 2 weeks before he'll be here. What we're trying to get a grant for would be to purchase the old Greens Foodway building and convert that into a health and fitness center and an education classroom. So we could do it. So we're working real hard to try to get that. The second part of our accreditation reviews, we have to go over our annual rate review for safety and wells for environmental health. I did attach a copy in y'all's packets of the current rates. On-site wastewater residential for a 2 to 3 bedroom permit only is $250 currently. If you get an issue that's off existing IP, it's $150 for both for $400. We have a 4-bedroom for $400. We have a 5-bedroom for $450. Do y'all think those need to be adjusted, or can we leave that as is for now?
What's our other counties look like?
From what I've been told in our, regional meetings, they're close to the same as what we have.
Those look awful lot better.
Okay.
What do you think, Keith?
Yeah,
So we will keep those as is then. The wells for a new well permit is $350. Well repair is $100, or well abandonment is $100. And consultation visit is $100. Redesign or revisit is $100. We would like to keep those the same if that's okay. We are working on getting our water lab back to the health department. We do have some things that we have to do to get it back up there in-house. So once we get our girls through with the training, we'll try to bring it back to where we can do it in the net. Food and lodging, food service plan review would be $200. Temporary food establishment permit $75. Yearly pool application fee $100. Swimming pool plan review $200. Annual tattoo permit fee $400. I don't think we have any in the county at this time.
Not voted.
Oh. Okay.
I don't know if
Okay. We did have one, but they moved their salon to Bryson City. So probably there's another name.
We had one in high school.
those fees are okay, or to review to leave those the same? Okay, thank you. So we can leave our fees the same for environmental health.
I'll ask for a motion on that, please.
Motion.
All opposed?
The next for environmental health is animal control quarterly report. This is for January through March. We had 6 dog bites, 46 food and lodging inspections, 4 well permits, 19 on-site wastewater inspections, and 66 site visits for on-site wells and complaints. We had like 2 or 3 in 1 week. Yes.
Like aggressive dogs, or just, hey, my dog was playing rough with me?
Well, one got hit in my car and the owner was trying to help it and it, yeah, so it's. Some of them are saying not aggressive. The next thing is our quarterly performance totals. For adult health, January through March, we saw 94 clients. Our BCEP, which is our breast cancer, cervical cancer prevention program, we saw 4. Child health, we've had 48. Family planning, 43. Flu shots or flu nasal, 3. Lab, 169. Maternal health, 6. Immunization, 71. And STD clinic, 14. Our next topic is finance, and I printed like I did at our last meeting, the expenditure statement for each department so that you could see where we're standing for the year. Communicable diseases, we've only used 21.02%. Then our COVID response, which is for communicable disease, 59%. Child health, we have went over on that in some areas, we're at 110%. Maternal health, 60%. Health and TV, 91%.
Is this the amount allotted for the order?
This is, where we're at for the year. The percents on there,
January through December.
they're from
July.
July till June, yes, so we're getting near the end, why, some of these are, yes, why some of these are a little elevated. Family planning, 88%. And please stop me if you have any questions. Healthy communities, we're at 94%. Environmental health, we're at 100.95%. This has a lot to do with, we're having to contract Swain County to come over to a lot of our sites where we did for a while. HIV and STD, we're at 42%. Breast and cervical cancer, we're at 84%. Yeah, we're at 75%.
What's the ideal percentage to support us?
At this time, we should be, Martha said, between the 80 and 90%. It's what we normally are at. Dental, we're at 79.98%. General health, 75%. Immunization, 65%. General administrative, we're at 118%. And this one is salaries and depending how the girls, put their time on their time sheets, what areas they worked on that day. That's why some are a little over and some are a little under. Because it really depends what they were doing for the day. WIG clients, 60%. WIG nutrition is 106. Those sort of wash each other out, those two. WIG breastfeeding, we're at 90%. Food and lodging. The reason it says 3.97% is because that's under the environmental health for contracted services and salary, because they've been paying Swain County contractors out of the environmental health budget. Because I asked Martha, I said, well, we're contracting, how's it so low? Adult health, we're at 108%. The opioid grant is 81.89%. Youth mental health, this is 78%. And this one runs out in the end of the school year, so that'll be the end of May. The CLC grant, we're at 81%. Then bioterrorism or emergency preparedness, we're at 62.77%. Any questions on the financials? Okay. We'll move into grants. The first one we'll talk about is the CLC grant with Clay County. We did get an extension to August 31st, so we will be splitting $29,000 with Clay County, and that will get us through to the end of August. The next one is Great Smokies Foundation, has grants coming available soon. I have met with Brian Husky April the 3rd, and then we've been talking every Friday since. And he thinks that they'll be able to help us with our provider for the health department. Depending on what the board wants us to do, we do have a new, if you will look at the agreement addendum that I gave y'all, this is a new one. It's 117 Public Health Infrastructure for Local Workforce Development. This is post-pandemic to help health departments increase their workforce so that they can continue to treat the public for illnesses and diseases that they need to do without the pandemic mode. This will be for Graham County. I talked to Stacy Herman Saunders in Raleigh today. She said that we should have the signed AA within 2 weeks, and that will give our health department $80,899 towards a new position. I would like to suggest that we use that for the provider, and that way that's money that y'all don't have to help us come up with on the budget. And then Brian said that he feels that Great Smokies Foundation can probably help us with the other portion to maybe even get a full-time provider instead of only 2 days a week. So this was a good surprise. The next foundation that we're working with is Cannon Foundation. The Cannon Foundation, they put a lot of money into capital budgets, purchasing property. Mr. Husky has to meet with them the 18th of May and give him the 3 top priorities that they recommend, and Green County gives them the top 3 for a fitness and wellness. So I was very happy how hoping we could be in the top 3.
What's the bed size?
They are actually taking pre-application requests right now. They don't publish the date, but Brian says it's probably going to be announced in June sometime.
So,
Yes, sir. And then the Great Smokies is going to be summer also. We do have a grant application going to Evergreen this week. That is for the peer support specialist. Half of their salary, we're asking for $50,000 grant from them. That's the max they get. And we are looking at applying to Dogwood. I've set in on some pre-application webinars. So we're looking to also apply for Dogwood to help with the peer support specialist. The only other thing under grants is that, hopefully we can get grants to do the peer support. We're hoping to get 100% of that. That's what we're shooting for right now. The next item would be budget update. The budget packet has been submitted. And then this new AA that I was showing y'all, the agreement addendum 117. I'll include that to Stacy, just as soon as I get the signed copy from Holly. Next, we have to report for our accreditation, child fatality prevention program update, and then a communicable disease update. And Sean's gonna do those for Megan.
And I think she gave you a copy of this, so I'm just gonna hit the highlights. This is our annual report for 2022 for the Graham County Child Fatality Prevention Team. The purpose of this report is to give a summary of the causes of death and number of cases reviewed, if any, and share our activities and accomplishments. The role of the commissioners and the Board of Health is to receive annual reports which contain recommendations and advocate for system improvements and needed resources if requested, and also to appoint members of the local team as identified by the membership. In 2022, thankfully, Graham County didn't receive any child death notifications to review. We have no identified system problems and recommendations for future prevention due to that. It usually takes a couple years if there happens to be one in the county. It takes 2 or 3 years for us to get the information, everything settled and released before it's sent to us to review. The annual CFPT activity summary was completed and sent to the state as required. We've had 4 quarterly meetings and we've had pretty good attendance with those. We've had 3 in-person at the health department and 1 Zoom meeting, and they requested that we go back to the in-person meetings at the health department, so we have 1 scheduled for June. Our topics has included child safety, swim safety, lead poisoning prevention, elevated blood levels, car seat safety, peer support program, safe sleep, and substance abuse and mental health education. And we want to thank you for the opportunity to share with you the dedicated work of our local team as we continue to review child fatalities, make recommendations, and take actions to prevent future child deaths. Now I have the
Next would be our old business. And we brought up at the last meeting our physical costs for sports physicals we want to do. But I don't think we voted, did we, Ken, on if we should leave it at 25 or increase it to 50?
We did not.
Okay. We've had a lot of people suggest we leave it at 25, so it would be affordable for a lot of parents for their children. Do y'all think we should just keep the sports physicals at 25 so people can afford them for their children? Yeah. Okay. Yes, sir.
Make a motion to leave the cost for the sports business at the health department to be $25 a piece. Have a second.
But
All in favor?
And is there any new business, that the board or advisory board would like to bring up?
We are talking about the directory, the medical directory, mainly Katie and I have been working on. We went to the travel and tourism, tried to get funding for it. It's about $6,000 to do a hard copy. And they thought that was not appropriate for tourists, that they would be willing to fund the mouse pads and the magnets that go on. I'm not sure there was anything else that they were willing to fund.
No.
And then, so they put one page into their new visitor guide that has all the emergency contacts. But for us to go to the Grand Star and let them edit all the, I don't know, dozen or 15 pages or so, they will, it was $2,300 to do the editing, and then the printing on top of that. The whole thing was up to about $6,000.
Just wonder if that's the bottom dollar.
I actually wasn't there when I was quoted, so I can't speak to that. I don't know where that number came from. Seriously, like I have no idea where that number came from. So I'd be afraid to say and be wrong.
there you go.
The alternative to that is, and what we had hoped was to have both, but the alternative is to have a web page under the county's URL that we can access, people can access with QR code and search for what they needed. And we've sort of bogged down a little bit, a few other things have intervened. But we had talked to Kevin Roper, and he was gonna get in touch with Tim Sullivan, who's having some health issues, so it kind of bogged down. And also, LaShawn Lambert at the high school was going to get back to me with quotes for printing the mouse pads and the magnets, and I haven't heard back from her yet. So
He's having a-
Yeah, you won't hear from her for a while.
Probably the question about the hard copy is for such a large amount of money, how many eyes are gonna actually be on it in 2023 versus the QR code? And is it worth that, so to the print that it's gonna have to be edited? Probably more often than not. Do we have a plan for that?
Well, it would have to be updated, if not annual, at least every other year, because everything in this county changes. People drop out, new ones are added. And I think as far as long as Katie and I are available or capable, we would be willing to update it. And it would have to be printed at probably a similar cost, although the editing might be a lot less down the road. But while the QR is, having the QR that will take you to an app and having that app on the phone, I don't know what percentage of people in this county have the ability or, the technical skills to access that.
Right.
And a bunch of people then don't have that, the contact, the signal to get that. So a hard copy
Is the
would
goal
be very useful.
Is the goal to get them in public places, or is it to get them in people's homes, or both?
beg your pardon?
It's the goal to get the hard copies like in public places or people's homes.
It would be printed in the newspaper, so everyone who gets the newspaper would have that copy. And it would probably cover some extra copies to have available, like a travel and tourism at the health department. You could put them, wherever people are, and any visitor centers, Stacola, Fontana, if that one is open.
Sure.
So I think it's very useful because
You
you
could,
can follow that.
ARBI as well, wouldn't it?
I mean, I think if I were to ask anyone in this room, some of the places that I was completely unaware of, I mean, if you needed help with, kind of anything, substance abuse or, home health care, anything like that, there is no one place that I know of that you can find that information out. So you have to either go through the churches or, I don't even, maybe the health department. But this information would be so helpful for a lot of people.
I think it's everybody, it's an exhaustive place to get all this exhaustive information. It's just, what's the board want to do about making this expenditure on the budget and or you want to wait and include?
Can I chime in real quick? So we do a medical directory each year for the region, which is a 3-county, Cherokee, Clay, and Graham. And each year we do a medical directory in February-ish, and it can list any business, doctor, health department, etc., in the region. And I think I had talked with you about that at one point. Yeah, we did. That's what I'm saying. We could also just expand it to that moving forward too. That's an option. I'm just throwing that option out there. If you guys want to have your standalone, I told Bob the same thing. If you want to have a standalone, great. We'll be glad to help you with it. But we can also make that medical directory even bigger than we do. Graham Star excludes, Graham Star's got 3-county one, but still it have a good reach. I mean, you're talking, at that point, you're talking about getting your word out to 3 counties instead of just one. And multiple newspapers, not just ours.
What kind of costs would be associated with that, off the top of your
No, but I can get that to you. I can look and see what we got charged for it this year, but
How is it separated? Is it by county or is it by specialty? Or?
it's organized, I believe, by specialty. So but people could take out ads in there and like you could put in there something Smoky Mountain Smiles and et cetera. So yeah, I should have brought one, but I didn't know we were going to be bringing this up. So my bad.
The ones I talked to your staff with, we were not talking about ads, it would be funded with ads, kind of complicates things.
Yeah, that. She's got one right there in her hand. Good.
The center part is 2-page spread of the Graham County government information.
Now, what the Graham County government offers, right?
Phone numbers don't take it anywhere, but the information is in there, and most of it, though, I mean, we have probably enough. Most of it is people who have bought ads,
Mm-hmm.
and
Right.
a lot of significant proportion of the information we gather is help for people who have lost their homes or are in need of emergency clothing or help with legal or negotiating the healthcare system, and those aren't establishments or entities that would be purchasing ads. So that would probably increase the cost. I mean, the Senate, what's for government here, we have more than enough to fill these 2 pages and 4 to 6 more.
But my thinking is you could maybe sponsor those businesses, inclusive in one cost, if the county wanted to do that. Then you're talking about getting your Cherokee counties, your Clay counties, your reaches, your outside entities that Graham County only is probably not going to get to unless you guys take them to reach or somewhere like that.
Well, we have phone numbers for REACH and
Right,
phone
but
numbers for AA, but it's tailored for people who live in the county.
Sure, I understand that.
The nearest the nearest hospitals,
Mhm.
the nearest veterinary services.
Sure, sure.
We also, something that is it Kevin Roper brought up was the legalities of, it's the Stark laws that he was worried about. If we favor certain entities over others, then we could get in trouble. So I'm not quite sure how we get around that. We'll have to talk to Becky, I guess, about that.
That's where the buying ads comes into play, because that's where buying ads comes into play, because then you're not showing favoritism at that point. Yeah, it's
Public agency bought the ad and we put certain ones in.
Let us talk to our attorney about that.
yeah, it's a good word, legalities. Yeah.
I'm running for lawsuits for a while.
Oh, no.
So, sure y'all be with-
Coming in this week's edition of the Graham Star.
Is there anything else? Any business or no business? All right. Do I have a motion to adjourn this morning? All in favor? All right. Thank you, guys.
Thank you.